Well, good afternoon, everyone. Thank you for joining us for another edition of TEPHI Talks. TEPHI stands for Texas Epidemic Public Health Institute. My name is Bob Emery. I'm going to serve as the host for this session. Really appreciate you taking the time out of your schedule. We have a very, very interesting presentation today, and also ample opportunity for folks to submit questions, and hopefully we can address your concerns as we go forward. My position here at the university is a bit unusual. Part of the time I'm the safety guy for the department, and then my faculty appointment at the School of Public Health. Before we get into the presentation, I'd like to introduce Dr. Janelle Rios, who's the interim deputy director for TEPHI, who has a few introductory remarks, and then we will get to our main speaker.
Hi, everybody. I double check. Am I sharing my screen again? Yes, okay, good. Welcome, everybody. Thank you so much for joining us today. And thank you, Bob and Allison, for being here. I'm going to share just a couple of things about TEPHI. We affectionately call it TEPHI. Quick overview. We have an interim structure now. We were just authorized last year by the Texas legislature, signed into law last summer by the governor, and then funded in the fall. We have three major areas, a readiness core, a communications core, and a training and resources core. And that's very exciting to be structured in this way, because it makes our small but mighty team so much more, there we go. So much more dynamic and impactful. Our Readiness Core has several programs in it, an early detection program, and we have several partners that are working on wastewater monitoring and other activities like that, data analysis, rapid assessment, vulnerable populations. And I want to highlight here the Business Operations Resiliency Program. And Bob Emery, Dr. Emery is charged with leading that particular program. We have an incredible communications core, and our training and resources core is doing some amazing work out there, both in-person and online training. And our training is really geared towards very specific audiences, such as scientists, healthcare providers, business operators, such as this particular event today, community health workers, both in English and in Spanish, and the lay public. And I really do want to highlight for you the certificate in pandemic preparedness and response. It's free, available to all Texans, and it's designed for volunteers here in Texas. We are very Texas-centric in our organization, and this program is really for folks who are interested in infectious diseases and preparedness. It's completely online. It's got 4 self-paced courses, and 1 live but online capstone exercise, which is really exciting. And we do provide the textbooks. So here on your screen, you'll see a QR code. You can scan that and register for the free class, or go to our website, tephi.texas.gov, to learn more. Now, a couple of housekeeping items for you today is that as you entered this webinar, we muted your microphones and turned off your cameras. It just makes it a little bit cleaner and easier for everybody to hear and see. Closed captioning is available. You can see it down below towards the bottom of your screen. It says a live transcription. Just click on that and closed captioning will appear for you. Please ask questions by typing them into the Q&A box. Please don't use the chat box, because I'm not going to be monitoring that one. I'm just going to be monitoring the Q&A box. At the very end, we're going to send you a satisfaction survey. Please fill that out. And we are recording this webinar, and that recording will be available in about a week. And that is all I have. And then Bob, if you can introduce Allison for us, please.
Sure. Thank you, Janelle. Yes, it's my great pleasure to introduce Allison Winnike, affiliated with our school as well, proudly a member of the University of Texas Health Science Center School of Public Health in Houston. That's great. But Allison's a national award-winning public health law and policy leader. She has a very impressive bio, which is actually posted on the TEPHI website. If you get a chance, I'd really encourage you to scan through it. I do want to highlight one item that really tees up this presentation so well, because apparently she has a crystal ball, because she was involved in 2016 with the publication of a pandemic and emergency response task force book, preparing for pandemics and emergency response bench book and operational guidebook for state court judges and administrators. That's remarkable. So after this presentation, I have Ms. Winnike accompany me to go buy lottery tickets, because she could see that far in advance there. So I'll turn it over to you. Thank you so much for taking the time to join us today.
Oh, thank you so much, Dr. Emery and Dr. Rios, for having me today. It is always a pleasure. Yeah, so I'm going to jump right in and start to share my screen with you. And we can have some fun learning about public health law. I think it's fun, so hopefully you guys will too. Okay, so you know, I've given hundreds of talks about public health law and emergency preparedness, taught courses on it. But this one, as Dr. Emery mentioned, is really focused towards our business community. And as we know, during this COVID-19 pandemic, has impacted every aspect of our lives, basically, and including, every aspect of, systems, including businesses. So we're going to talk about that. I am a lawyer, so I always like to give my legal disclaimer that this presentation is for educational use only and does not constitute legal advice. But please ask questions. I'll give you my contact information at the end, so you can contact me later, because I'm always an open resource for folks across not only the state of Texas, but around the country when they are dealing with what seems to be a quite confusing labyrinth of laws and policies related to public health law. So yeah, we're going to learn about public health law principles, and we're going to kind of lay the groundwork for how some of these are developed, and then how then they impact our business community. So when this comment came out a couple of months ago, I thought it was really great, because it does sum up what we sort of call the pandemic malaise that folks are, they're tired of all the emergency. They're ready to get back to their lives. A lot of folks, didn't think that something like this could last this long, which I will tell you that pandemic wise, we're actually getting through this COVID-19 pandemic pretty quickly compared to what it could have been. But this is something that, at least for most Americans, is kind of a once in a lifetime event, knock on wood so far. And, but my point in sharing this is to emphasize that the COVID-19 pandemic that we've been going through, that we're still continuing to go through, is not a one and done event. I mean, I personally have been working on, public health, emergency and preparedness for over 20 years, way back to when I worked on the 2001 biopreparedness bill that we did in U.S. Congress when I worked in the United States Senate. And so this is something that some small group of folks have thought about and planned about for years and years and years, because that's what you have to do. And you can't think that, the things that we have gone through, we won't ever go through again, because we absolutely might. And that's why I'm so glad that so many folks are on this call. And I wanted to share, and again, talking about the business community, that we all have a role in public health. It's not just, our professors that we have at the UT School of Public Health. It's not just the folks who work in our local, state, and federal health departments. It's everybody, because public health refers to all these organized measures, whether they are in the public sector or the private sector to prevent disease, promote health, and prolong the life among the population. And so a lot of times we kind of think about silos. And what I really want to do is kind of break down some of those silos. And hopefully that we continue to understand that is one thing the pandemic's taught us, that this impacted everyone. And so everyone also needs to be part of the solution as we deal with this and we move forward. So federal public health emergencies in Texas. I just made this list going back to 2005. And one thing that I wanted to emphasize by showing you this list is that, and again, these are just public health emergencies that were declared at the federal level that impacted Texas, that they're diverse. I mean, we're talking about opioid crisis, that's a public health emergency. Monkeypox, that, you know, is a new one. Obviously, COVID-19 is the one that most people are familiar with, but there are other public health emergencies that can derive from, you know, natural disasters like winter storms, hurricanes. We get a lot of those. So it's not just an infectious disease like COVID-19 that can cause a public health emergency. And also the reason I shared this list is that the scope of these can be quite large, like you're talking about COVID-19, or it can be something that is more isolated, even geographically, whether we're talking about hurricanes like, you know, Hurricane Harvey or Ike, you know, that didn't impact everyone equally. And so this is something that I also want folks to kind of understand, that the term public health emergency isn't a blanket term for the type of the severity or the breadth or anything like that. What it really means is that there's an event public health wise that has created such a strain and a need for resources, either at the local, state, or federal level, that an emergency has been created so that resources can then flow more freely, whether it's from state to local or federal down to state and then to local, to address these crises. So here's another thing I mentioned, you know, years ago, I worked in the United States Senate on the public health subcommittee and in the majority leader's office. And we had a couple sort of localized public health emergency issues that I was personally involved in. You know, we had an anthrax letter sent to the office across the hall from us. And the first responders, the police officers who were responding, they actually came across the hall to my office to use the phone to call for backup. And then anthrax ended up getting all over my office. So that was in 2001. I just take all this chemoprophylaxis. I was out of my office for 6 months for the decontamination. Then just 3 years later, in 2004, we had another, bioterrorism attack. A RICIN letter was sent to my office. But this time, as you can see in the photos, the response just 3 years later to the same issue of a bioterrorist attack sent via letter, the response was completely different. Their first responders showed up in PPE. They immediately secured the area. And the point that I'm sharing it with you is that every emergency we go through, every public health emergency we go through, we're always learning, and we're taking that information and we're building it back into our new policies and plans. It's a continuous cycle, just how I'm sure in business, you do business improvement cycles and how, you prepare for different aspects of your business. That's what we do in public health too, in public health emergencies. And one thing that I know that is sometimes difficult for the public to grasp is that, in public health, this is, we're taking scientific data and medical data and analyzing it and trying to find what is, the most appropriate action steps to take based on the data that we know right now. Think of it as like a science experiment when you're a little kid. You got your hypothesis and you're moving through But that too is a cycle. And one thing that a lot of folks were frustrated with during the COVID-19 pandemic is first say, public health would come out and say, okay, take, these, X steps to help combat the virus. Well, then maybe a month or two later, they might come back and say, okay, now we've tweaked this and now we want you to do, these Y steps. And a lot of folks were upset and said, well, whoa, you told us this a couple of months ago. And that's what I want a lot of folks to understand is that it's not that they necessarily said the wrong thing first, or that you shouldn't be believed when they, you shouldn't believe these experts when they speak. It's because new information has been gathered and gone through this process to tweak and refine the best practices coming out. And so that's what I hope that, this story and these photos will illustrate. And again, and especially, to the business community, that's such a link with the lay public at large, is to understand that concept that when new information comes out, it's because we now has gone through that process to get to have a more informed and better decision making. So I also share, Dr. Emery mentioned, I've worked on a couple of books over the years, a state book for Texas, a national book as well, these are really great free resources that I've provided the links for you to look up. Okay, so let's get into this. Foundations for public health law. So what is public health law? What are we talking about? It's the intersection of the legal authority and duty of the government to protect the public's health. So it's that intersection with the legally protected rights of an individual. And when I say legally protected rights of the individual, think about things from, the Constitution, the Bill of Rights, things like that. And I always, my public health law students, I tell them it's like a seesaw. It's a balance. It's not static. There's always this balance that we're trying to hit between the government's duty to protect, the public's health versus our individual rights, to make sure that it doesn't swing too far one way or another way. And so again, that's something I like to emphasize, is that it's fluid. We don't always get it right. We're continuing to try to move towards that perfection, but it's a process. And sometimes we have to go back and make tweaks to how we execute for the next time around. So when you, I'll try to go through this quickly because I know you guys aren't law students, but there's a couple of legal principles to protect the public's health that I want to share. And they're of course in Latin, Salus publica suprema lex est. That's the legal concept that the health of the public is the supreme law. And that I think is really important. Another one is parens patriae. That's the parent of the country. It's the duty that the government is supposed to engage in activities that try to protect everyone and not just particular groups. And then lastly, sic utere tuae ut alienum non laetus, which means use which is yours so that you do not injure others. And that says, yeah, you have the freedom to undergo and take activities and exercise your rights as you would like, until you get to the point that those activities then harm other people. And that's the point where, your freedoms stop once you're causing harm. And we do see that in the pandemic when we're talking about when they make rules about whether it's for masking or social distancing or vaccinations, things like that. The reason is to protect everyone. And there is a limit, as to what an individual can do with their own freedoms, that they don't injure other people. Okay, so governmental duties, power, and limits. Think about this. Does the government have a duty to protect the public's health and safety? Yes, absolutely. When you're looking at power, what power does the government have to regulate in the name of public health? Well, it's actually pretty considerable. And then you say, what are the limits that exist in public health powers? Well, there are some limits, and we'll talk about those. When you think about public health interventions, and particularly when there's some kind of emergency, but this applies in non-emergencies too. The different levels of public health interventions, they start at voluntary. It's when, you know, your public health authorities or the government says, hey, we suggest you should do this, such as you should wash your hands before you serve food to others, because we have the science that says that you know, improves food safety. Then you have a level that's mandatory or required. And that means that a person has to do this to receive some benefit, but they have a choice. They can either not receive the benefit, or maybe there will be a penalty. An example of this would be like a vaccine requirement for school. You know, all school children in Texas have to have, you know, their measles, mumps, rubella vaccine to attend school. And if they don't, well, you can either, you know, homeschool instead, or go through this other exemption process. And then the last level is compulsory. And this one hardly ever happens. But a lot of people think, and what this means is that, you know, the government says you have to undertake an action. And if you don't, there's no choice. They force you to. And so a lot of folks, they confuse that second level of mandatory versus compulsory. And the government very, very rarely, you know, comes over to your house and forces you to ingest medicines or other things like that. There may be, it usually is in that mandatory level where you may face a fine or other sanctions if you don't go through with the government sanctions or the government control measures. And here's just a list of some of the public health control measures that are in statute in the state of Texas. And they're really broad, you know, quarantine, isolation, you know, a person can be detained or restricted of their movement to make sure that they're not spreading disease. You know, there can be forced to have chemoprophylaxis or immunization, education. All of these things the government has the power to do if they're trying to stop the spread of an infectious disease in their community. And again, that community could be hyper local, it can be statewide, it can be, you know, nationwide as well. And so the government, again, has this really important duty, and they have these powers as well. But now I'm going to go back kind of on the flip side and look at the limits. And this is the stuff that, you know, when these types of interventions are put on an individual or a business, in a business community, we have to look at these during that seesaw balance. You know, is what the government is wanting us to do, is it effective as an effective public health solution? Is it proportional to the problem? You know, if they say, oh, let's shut down all businesses in the state of Texas because, you know, there's a bed bug outbreak, well, that's not really proportional, or is it going to be effective? Also, has to be necessary solutions. They also have to be the least infringement on our individual rights that possible, while they can also be effective, and there has to be public justification for them as well. So that's kind of my very, very quick and brief overview of what public health law is. Now I'm going to move over to the policymaking and jurisdictional considerations, because this is where we get really tripped up, you know, in the business community and even for individuals about what's going on with these public health laws, and, you know, whose declaration or statement is more valid than the other. And so here we have the levels of government. And I know you're probably thinking, Allison, I thought you said you were a law professor, and this looks like a grade school pyramid. Well, it is, but I just want to really remind you of the 3 levels of government, and that they are all separate and they make their own decisions. They have their own decision makers. And that's why you may see different information coming out of each level. And you normally think, state trumps local and federal trumps state, but that's not always the case in public health specifically. And so we're going to talk about that a little bit. And again, the branches of government, and we saw this too during COVID. You got your legislative bodies, whether it's your state legislature or Congress, they're making these rules. Your executive branch is carrying them out. And then you have the court system. They're the ones that are weighing, whether these rules and activities are, they meet that public health law threshold that I talked about earlier. And again, I know you're thinking this is basic, but these are really just like compounded in a very elaborate tree. And now we're going to get even more confusing, because when we're talking about laws mean all kinds of things. It means statutes. Those are the things that come out of your legislative body. Then they get codified into codes. Then you have the regulations that are coming out of the executive branch. They also have the force of law, and then rules coming out of there. Then you have your ordinances, your local ordinances, maybe from a city or county. Then you also have executive orders. Again, that can come from like your county executive, which we call the county judge in Texas, your mayor, governor, president. And then you have case law. That's the law that goes through the court system. And so the reason I share this is to illustrate is that every single one of those is an equally valid law, and they may conflict with each other as they go through the legal process. And so don't feel bad if you feel confused, because different people at different levels of government are saying and doing different things, because they all may have the valid authority to do that, but then they can conflict in different ways, whether it's kind of vertically or horizontally, or in this weird web of what a law is. But anything that come out of those, you would say, yeah, that's the law and that I have to follow it. So now I'm going to throw one more, wrench into this toolbox. So we talk about policy window, and I want to mention this really quick, because I told you like all of those different types of things that are laws. Well, even to get something to be a law, it has to sort of reach this perfection where you have a stream, you have problems, then you can have possible solutions, then you have the political circumstances that come together to get a window of opportunity to even get it to be a law. And so again, there's just a lot. It's sort of like the sausage being made in the background, and it's me personally working in it. I understand all of those different parts, but I know the public, and especially the business community, it's focused on other things. It just looks like a lot of confusion and bickering and infighting going on, trying to come to a solution. So talking about how, the different roles, I mentioned this earlier, the judiciary's role really is to do that balance, to balance what the government is doing with their laws, regulations, all of that stuff, enforcement, versus our individual rights. And this really, I wanted to share with you, this is a seminal case in public health law. This is what gives the government, most of its powers related to this. This is Jacobson versus Massachusetts, and it's from 1905, a Supreme Court case. And it upheld the use of what we call police powers to protect the public's health. And that does mean that, a state has these powers to take actions, and they can delegate them down to local health authorities, and they can impose limits on individual liberty if necessary to protect the public health. And that includes business operations and business actions as well. And, the quote from it is that, yes, there are manifold restraints to which every person is necessarily subject for the common good. And, and we all know, because of another Supreme Court case, corporations are people too. So it absolutely applies to business. And so this is where things get a little bit confusing when I talked about that pyramid hierarchy of government. It's the federal versus state jurisdiction specifically for public health. In the United States, it's the state that have the primary responsibility for protecting the public health. And like I said, they can delegate it down to the locals. And it's the federal government's power in public health has to do with the international and interstate transmission of disease. And those all federal powers come from the Constitution. And so if the federal government is doing something related to public health, it either came from the Commerce Clause or it comes from the Taxing and Spending Clause, which is admittedly very broad, but just know that this isn't completely open. The federal government cannot do whatever they want related to public health. It really does have to come to the Constitution. And that's where sometimes you see that fight between things going on in the states and the federal government and how those can conflict sometimes. And so I'll give you a few examples of some federal public health powers. Like I said, we're talking about things that go on interstate and internationally. And so they're supposed to stop the spread of diseases coming into our country or when they spread from state to state. And they have this federal list of things where an individual can be quarantined at the federal level, and they can do public health emergency authorizations or emergency use authorizations with the FDA that we have done quite a lot during the pandemic, whether it's for vaccines or other therapeutics to try to, reduce for, treatments or therapies for COVID-19. But now we get to the state level, and this is really where the bulk of the powers come in the United States, because in the 10th Amendment of the Constitution, it says that any powers that were not given to the federal government are reserved to the state and to the states. And so what this concept called police powers, it doesn't have to do with law enforcement at all, but it has to do with the concept that to protect the health, safety, morals, and general welfare of the people. And that's a huge umbrella. And a lot of this public health stuff falls under that umbrella. And it's a really broad power and responsibility that the states have to protect the public's health. And so we look at kind of the executive role. And again, there's all these different roles within the federal and state government, and they all have valid, spheres in which to exercise. And your executive, they can, order the implementation of control measures to prevent the spread of disease. Which we've seen either things coming in Texas coming from the Department of State Health Services or executive orders from the governor. And in Texas, we have our governor, our Department of State Health Services that focuses on public health, and we have local health authorities. And like I said, the governor has a lot of powers. They can declare state of disasters. They're required to work with the federal government if there's a federal public health emergency. They work with our Department of State Health Services commissioner to declare a state public health disaster if that's appropriate as well. And we've also had those declared here in the state of Texas. So you've got federal state of public health disasters and state public health disasters, and you can even have a local public health disasters, and they can all mean different things. And, in our state health department, they're doing all this work behind the scenes, trying to implement these control measures, investigate disease cases. And then during these emergencies, we're also talking about working with the Texas Department of Emergency Management and trying to get all of the logistics worked out for something that's so broad as a pandemic that affects everybody. And then in Texas, we also have these local health authorities, and they might be for a city or a county, and they, do disease reporting and investigate disease cases. And this is a lot of people don't know about local health authorities, but they are an officer of the state who is a physician with a 2-year term. So I'm trying to move through this quickly enough so we have time for questions and discussion. But so then the other thing that I wanted to talk about again is jurisdictional coordination. And so this is something that it's confusing even for people on the government side to figure out. So of course it's confusing for the general public and our business community as well. But when you're talking about, actions to try to protect the public's health and these sort of what potentially restrictions on business activities, we got to determine which is the jurisdiction that has the authority to take this action. Is it local, state, or federal officials? And whoever is the primary jurisdiction, they're responsible for the response. And this is where we come kind of full circle back to the first slide that I had about public health emergencies, is that if resources are inadequate, whether it's at your local level, your state level, or your federal level, they create these public health emergencies. And I always say, if you hear that something is a public health emergency, what that means is that it's about money being able to flow between different levels of government to help address the problem. And so that, again, I know is sometimes confusing to a lot of people. It doesn't necessarily refer to how many people that the emergency affects, or geographically how broad it can apply to folks. It really is about, at whatever level has the primary jurisdiction, they don't have enough resources to address it. And it can be something as simple as a localized disaster, that they don't have enough ambulances or things like that to address the wounded. And so then they can ask for resources in other communities or the state level. Or it can be something huge like a pandemic, when we're talking about trying to organize really elaborate schemes and funding and things to address. And so, okay, I tried to go through as fast as I could, because I know that always the questions and the discussion part is the fun thing. And so I'll say just a couple of words before we open that up, is that, you think about how when some action comes out, whether it's like a federal regulation to the business community about saying, employers who have over 100 employees must have their employees vaccinated, and then that may get challenged in the courts, and that came through a regulation, and then that gets challenged in the courts, and then it goes through that process of weighing, is this too restrictive on individual liberties? Is it necessary? Is it justified? And a court may decide. Then it may go through the court system to the top of the court system to determine, where it gets appealed or not appealed. And then there is an answer. And that is the case law that then people must follow. And I know that it's also sometimes frustrating, because say that same case could have gone in front of another judge and it could have a different answer. And I know that's particularly frustrating to the business community, that, really to be successful and plan, which that's something that's really important for businesses. It's good to have like concrete answers that aren't going to change. But in very particular, when you're talking about public health emergencies and we're trying to tweak things and try to get them right, and based on the latest scientific evidence, that's one of the main points that I want to share, is that they might change, and it's okay. And I know it's because they're trying to perfect it and get it right. Even though I know that it does cause disruptions, and it's not always, exactly right the first time. And so hopefully that concept I shared adequately with you guys. So thank you so much. And this is my contact information if you guys want to reach out, or you have any particular extra questions, because I know everybody's questions are different. But then I'll throw it back to you guys and see if we have any Q&A.
Thank you, Allison, for the presentation. I got a slew of questions here, but I know that Janelle's also assembling them. But I'm wondering if you could back up for a bit, because that was definitely drinking from a fire hose for a lot of information. But could you clarify for all of us the role of the CDC? I think early on, I've made several notes about this notion of the expectations changing because this was a novel virus and things, maybe collectively we could have done a better job of keeping that term novel to set the expectation that things may change as new knowledge is gained. But what I really wanted to focus on was the notion that the CDC doesn't make laws. I mean, it provides recommendations, but then you go down to those different layers. So I'm just curious what your comment there is on it.
Yeah, absolutely. That's wonderful comment and question. And so the CDC is the public health agency within the federal government, within, the federal HHS. And the CDC's role, they don't make laws and rules at all that apply to the states at all, period. It just doesn't happen because, again, how I talked about, it's the states have the primary jurisdiction for public health in the United States. But what the CDC does do and what they're good at and their purpose is that they are supposed to be the expert resources for the state health departments and in turn the local health departments. And so one function of the CDC is about data collection and analysis. And so one law we have is that the local health department send disease data up to our state Department of State Health Services, and they collect it and analyze it for the state. But then they also send that data up to the CDC, and the CDC is collecting that for the entire country. And what the CDC does for that data is they analyze it, they look for trends, they share the information down to the state departments of health. And the state departments of health are the ones that make the regulations that affect the folks in that state. And so when you hear things from the CDC, you'll almost always hear the phrase CDC guidance. And that's because based on their expert analysis of data, this is their recommended scientific guidance. Now, states, you take that guidance, see how it would apply in your state, and now you make the laws and rules that are executed based on that.
So to follow along, because we've had this question come up several times, let's just take Texas as an example then. So the information comes back down to the state of Texas, but individual local authorities, I don't know if that's the right term or not, but a mayor or something may have a different tolerance for risk, so to speak. I don't know if that's an appropriate term, but as the information comes back down, it's the governor that has, or the state level is where the rule would be made, right? That rule would overpower anything that might be made at the local level. Is that correct? Or
yeah. So there's a legal concept called preemption that we deal with a lot in public health. And so say the CDC came out with guidance that says, I don't know, you should brush your teeth for 1 minute a day. We recommend that. And then the state says, that's good, but we think in Texas, let's make a rule that you have to brush your teeth for 2 minutes a day. Well, then maybe a local mayor is like, oh, in our town, we think 3 minutes a day, that's the amount. Now, that could work. There could be a state law that says 2 minutes a day that applies to everybody, except for just the people in this town where it's 3 minutes a day, unless the state passes a law that says local mayors, you cannot make toothbrushing laws. Whatever is the state law on toothbrushes, that's the rule for everyone. And so we've seen that like with fracking several years back, some local areas that they were having earthquakes from fracking. They were like, okay, in this city, we don't want fracking anymore. We're tired of the earthquakes they cause. But then the state legislature in Texas, they made a law that said, we forbid, local cities to make fracking laws. And again, it's the states that are making those laws. The CDC might have guidance for those things, and that's just based on their expertise in analyzing the data they have, but they're not making any laws related to that. But the CDC guidance, that is really considered the gold standard. That's why you see so many businesses saying, when the CDC puts out guidance for business about the pandemic, which they've done, several releases on that, businesses will just take it and run with it because they're like, look, the CDC said these are best practices, so we're going to do it. And unless your state kind of has a higher standard, you're usually not going to run afoul of any law, because most people take the CDC guidance and then turn it into law. Not always, because again, you have all your 50 states and then the territories too. But that's why the CDC guidance, it's given a lot of deference, but legally it's not something that has to be followed.
I see. Interesting. So I have a bunch more questions, but I'm going to hold off and ask Janelle, because she's been monitoring the Q&A box, and we just want to encourage others to use the Q&A box as well. I can't see it from here, but I know Janelle's been the arranger of that.
Yes. So let me pose this question. I'm not always sure which laws or rules I'm supposed to follow. As you mentioned, sometimes it seems that the laws and rules conflict with each other. Which laws or rules are the most important to follow?
That is a very tough question to answer, and I'll answer it in a roundabout way. So the federal government made a regulation through CMS, the Centers for Medicare and Medicaid, and it said that if you're a hospital and you take Medicare money, then you have to have your workers be vaccinated against COVID. So that's a regulation. And the reason they could make that is because it was based on the taxing and spending clause that they can make powers through. They're like, hey, this is our federal money. We're giving it to you. And if you want to take our money, you have to follow our rule. Then at the state level, specifically in Texas, the governor made an executive order that said hospitals cannot force their employees to be vaccinated. So that's a classic example of a federal regulation, because again, it's a law, versus a state, executive order, which is also a law, and they're in direct conflict with each other. But it's because one came in the form of a regulation based on money, and one came in the form of just an executive order. So it's like they conflict a little bit crookedly, right? It's not like they can just appeal one and go through the court system, because they're on different tracks. And this was a problem that a lot of folks had, is that basically what hospital is going to say, I'm not going to take your Medicare money? No hospital is going to do that. But if they do, if they take the money, then they're in direct violation of the governor's law. And that's what they're, and I consulted, with a lot of hospitals about this when this problem happened. And it's basically your pocketbook versus breaking the law. And what I had said a lot at the time, it's kind of like you're playing chicken. And it was like the governor, playing chicken with the federal government and vice versa, because they know that these hospitals have to keep taking the money. And so then that's when then we kind of go through this, the political process of compromise to try to get to a solution. But that's the perfect example that they may conflict with each other, and there's not a really good immediate solution to say, I have to follow this one and I don't have to follow this one.
Yeah, that was tough. That was a tough one. But it kind of does roll into this next question about requiring employees to be vaccinated. I'm a small business owner. Is it legal to require my employees to get vaccinated?
Yes. And maybe. So before the pandemic, before we had any sort of, executive orders and laws and things like that, the answer is a full blanket yes. you're a private employer, you can have as a requirement of employment at your work that an employee be vaccinated. Happens all the time, especially in the healthcare setting, obviously, because it's about protecting patients and things like that. Then you had, during the pandemic, different executive orders coming out saying, public employees, can't be vaccinated, private employees, and things have kind of gone through, but it's still that, and sometimes they tried to, circumscribe them to be just specifically about COVID-19 vaccines. But still, there's the basic legal concept is, as a private employer, if you want to have as a condition of employment, folks be vaccinated about whether it's certain vaccines, whether it's flu, polio, whatever, or it's all CDC recommended vaccines, that's still generally fine. And the other wrinkle that we went through with this a lot was that until fairly recently, the COVID-19 vaccine was an EUA vaccine. That means an emergency use authorized vaccine. And so you can't require folks to be vaccinated under an EUA vaccine generally, because it still hasn't gone through all of the official process that all of the other regular vaccines that we get vaccinated have gone through. And so that was something that we dealt with earlier on in the pandemic, is that you had a lot of recommendations to get vaccinated, but you couldn't necessarily force someone to get vaccinated under an EUA. And so now we're in this new political sphere that we're dealing with in not just in the state of Texas, but in state legislatures across the country, looking at that concept of, private employers and vaccination requirements. And even things are opening up with public schools and vaccination requirements that, for pretty much since the beginning, since we've had vaccines, never been questioned that, public or private employers or even schools could require these as conditions of attendance or employment. But now we're opening up that public debate. And so we're going to see where that is going, over the next year or two, probably. But generally, the answer pre-pandemic was yes, a private employer, you can make those conditions. Hopefully post-pandemic, that will continue as well.
If I may, even what you just described there's also this option for someone to get the exemption, though, right? So the employer could, as a possible solution for a business operator, if they're hesitant to make a rule, they want to protect their employees, so they want to make a rule that everybody gets vaccinated, but they could make folks aware that they can pursue the exemption or whatever that process may be. But it just has to go through a formalized process. I don't know if I'm speaking out of turn there or not, but.
So yeah, you're right. So there, when we have laws related to vaccine requirements, there is an exemption process in every state. If you legally require an individual to be vaccinated, they have a medical exemption. So say if you're allergic to the vaccine, then you can go through this vaccination process or this exemption process to not be subject to that law. In some states, they also have religious or conscientious exemptions. Not all states have this, but if you're like, it's against my personal beliefs, then you can go through that personal belief exemption as well. But in the sphere of truly like private employers, like a private business, that employer, that business is making a rule just for their employees. You don't have to have an exemption, although I personally would say that if you have a rule for vaccination in the workplace, I would always have at least a medical exemption in there. That's, I think, the proper thing to do, and you'll get less legal issues related to that. But again, that's your own individual business policy. And so it's not necessarily subject to the other laws that you see out in the state or federal level.
Janelle, did you have more?
Yes. So, related to this conversation, and we're not going to get to all the questions. I'm sorry, everybody, but this question I think is really relevant to this part of the conversation. If a business requires an employee to take a vaccine and the employee has an adverse reaction, is the business then liable for any personal injury or medical costs associated with the adverse reaction?
Okay, so generally, no. So we have, and this is also something that is a federal program. We have the National Vaccine Injury Compensation Program, and this was created in 1984. So if any individual has an adverse reaction, they can go through this process. They apply. It's a no-fault compensation process. So if you were injured, you get funded for the injury, period. It's not like an adversarial or things like that. And so the reason that was done was to provide, legal protections for, the pharmaceutical makers and things like that, so that there was this avenue that if folks were harmed by a vaccine, that they could get this federal compensation, which is, it's a fund that, is funded by these vaccine makers. But, that's kind of, you can't forecast, especially as a business owner, what might be like the 1 in a million bad reaction and things like that. That's why we have, when folks get vaccinated, they get the vaccine information sheet that lists all of the possible side effects, and that they can talk to the healthcare provider to make that decision. So they're making their informed consent decision whether to take the vaccine or not. Because again, even if you think about those 3 levels of public health, even as an employee, they still have the choice whether or not to take that vaccine. Either they can be employed at this company and be vaccinated like the rule says, or they can seek employment somewhere else where they don't have to follow the vaccine rules. So no one's forcing an employee to get vaccinated because they have the choice whether to work there or not.
All right, we're getting to the wrap-up time here, and I know there's many other questions. So Janelle has some closing remarks, but I think we can address how some of these latent questions might be bundled together and might be able to be addressed. But first of all, Allison, I want to tell you thank you so much. There's so much to digest here, but you've opened up my eyes on a bunch of issues I had not thought of before, and it is not as straightforward as one could imagine. This has to be one of the extreme cases in the practice of law that has to be on the far end of these variabilities. So thank you so much. I'll kick it over to Janelle there. You had to.
Great, thank you, Allison, and thank you everybody for joining us. As soon as you exit the webcast, you're going to receive an evaluation survey. Please fill that out because that really does inform the next events that we're going to have. And remember, the recording will be available in about a week. You'll get the link via email. And think about that certificate in pandemic preparedness and response. And just a couple of upcoming events that we've got. On November 9th at 4 o'clock, we have Grand Rounds, and that's going to be COVID lessons learned in Fort Bend County. So that's going to be exciting from a county perspective. And on December 6th, we'll have another TEPHI Talks about supply chain breaks in medical supplies and by McKesson Medical Supply. So thank you again for joining us. And Bob, I send it back to you.
Okay, thank you so much. So look forward to consolidating many of these questions, and Allison, we'll see if we can pass those on to you, and then there might be a way that we can actually post them, maybe brief answers on the webpage as a follow-up for those who have pressing questions there in that regard. So,
yeah, absolutely.
Okay, yeah, thank you so much, and hope folks can join us in December for the next round of our TEPHI Talks then. Okay, thank you so much.